years ago, we see 0 fentanyl in Arizona. Last year, we seized enough fentanyl to kill 75 to 80 million people.
It's fast-acting and powerful, nearly 100 times more potent than morphine. The FDA-approved medication is so strong, even a small amount, the size of 2 grains of sand, can be deadly.
It's stronger than heroin, heightening the opioid epidemic to scary levels because it's so easy to get and so easy to overdose.
So you have to keep doing more, and then your tolerance goes up, and before you know it, you got a problem.
But unfortunately, the number of deaths due to fentanyl is increasing.
In Arizona, people are ODing, even dying from illicit fentanyl pills.
It was cheap. It was really cheap.
That can sell for as little as $9.
And this is where the local experts should come together.
This month, Arizona's family investigates fentanyl.
Where it's coming from.
The lives shattered.
It ruins families. It ruins lives.
And from law enforcement to doctors and schools, our communities fight in this crisis.
So fentanyl is here in Arizona and could be in the hands of someone you love.
The counterfeit pills are flooding the streets and even our schools. In the past year, teenagers have died in Tucson, Phoenix, Yuma, and Prescott Valley.
These were teens who were not drug addicts and they had families from different backgrounds, different incomes. This morning, pay attention to the bottom of your screen. We're going to have facts about fentanyl and emphasizing why Arizona's family is tackling this crisis all month long. Living in Arizona makes us especially vulnerable. The pills are made in clandestine labs in Mexico and smuggled through ports of entry at the border. Last month, U.S. officials made the biggest fentanyl bust ever in Nogales. About 250 pounds were seized from a truckload of cucumbers. More than 2 pounds of pills were also there, which were meant to be sold to teens and others for about as cheap as $9 a pill.
Doctors say people who overdose on fentanyl have just 4 minutes to get the antidote Narcan. After that, if they survive, some will have brain damage. The Banner Poison and Drug Information Center says fentanyl-related calls have jumped from 60 in 2016 to 260 last year.
And this surge is something the Valley's medical community is paying very close attention to. Cameron joins us now with how a Valley doctor has changed how he prescribes this drug. Good morning.
Good morning. Over the past 10 years, this has really changed. 10 years ago, the opioid problem that we have now is not a national crisis. Back then, that was because of the extremely powerful opioid fentanyl. It was a drug that you could only get in a hospital during a major surgery, all while under the close watch of a doctor. But now that has changed, and doctors are prescribing fentanyl to patients who are recovering from minor knee surgeries, putting patients on a path to addiction and the nation in a state of emergency. Instead of sending patients home with the highly addictive pain pills like Percocet and Vicodin, even fentanyl Band-Aids are just Band-Aiding the pain. Dr. Matthew Crooks's proactive approach involves giving his patients a cortisone shot that not only stops the pain, but over time heals the pain-causing problem. Crooks's clinic, Pinnacle Pain and Spine, sees a lot of patients with back or joint problems. Bill Rahr is one of them. He recently re-injured his back after being in the Flagstaff snow. We were inside the operating room as Dr. Crooks unpinched his nerve using a simple shot of cortisone. When the surgery is over, Rahr won't need prescription pills and, in fact, will likely be back to normal the next day. Rahr says he's seen the effects of opioids and would rather suffer through the pain than get hooked on painkillers. He says the alternatives Dr. Crooks is offering is a step in the right direction.
What Dr. Crooks does is a real answer, I think, that maybe a lot of people aren't really aware of. When you run out of your 30 pills and you're still hurting, and you call the office of whatever physician it might be, they give you another prescription for another 30 pills. And then, if they don't want to renew it again, they go to a different doctor and get more pills. You get too addicted to that stuff and you hear too much about it, and I don't think it's absolutely not worth the gamble.
Well, the treatment Crooks gives his patients are extremely simple, and some of them are done in just minutes. He says if patients do need some medication after a surgery, they are prescribed a very small amount until the cortisone shot takes its full effect for the day. Dr. Crooks, who we heard from last hour, says fentanyl is 100 times stronger than morphine. He says the only people who need fentanyl outside of the hospital are terminal cancer patients who are in extreme pain at the end of their life. He says any reason short of that is the wrong answer for patients. Coming up in about a half hour, we will hear from an expert here in studio to talk about how to spot if your loved one is using opioids. That's coming up at 6:45.